Have you ever woken up feeling like there's something sitting in the back of your throat, even though you don't have a cold? Maybe you clear your throat several times before you can even finish your first cup of coffee. Perhaps your voice sounds rough in the morning, or you keep reaching for water because your throat feels coated with something you can't quite get rid of. Now, here's the question I want you to think about. What if those symptoms have very little to do with your throat at all? Most people immediately blame allergies. Others assume it's sinus drainage, dry air, aging, or simply something they'll have to live with. Some spend months trying cough syrups, throat lozenges, antihistamines, or nasal sprays without ever seeing lasting improvement. But what if the real source of the problem isn't above your neck? What if it's much lower? Today I want to walk you through a condition that affects millions of adults, especially after the age of 60, yet often goes unnoticed because it doesn't always look the way people expect. I'm Dr. James Carter, and over the years I've met countless patients who were convinced they had chronic throat problems when, in reality, their digestive system was quietly creating those symptoms all along. One woman I'll call Margaret came to see me after nearly 18 months of frustration. Every morning she felt as though something was stuck in her throat. She constantly cleared it during conversations. Friends kept asking if she was getting sick because her voice sounded hoarse. She had visited several clinics, tried allergy medications, changed her diet multiple times, and even wondered if stress was causing everything. Yet there was one symptom she never had: heartburn, because she never felt that familiar burning sensation in her chest. Reflux wasn't even part of the conversation. And that's exactly why I want you to stay with me today. Many people believe acid reflux always announces itself with severe burning after meals. In reality, that's only one version of the condition. There's another form that can quietly affect your throat, your voice, your sleep, and even your daily comfort without producing classic heartburn at all. If nobody explains the difference, it's easy to spend years treating the wrong problem. By the end of this video, you'll understand why your symptoms may have been misunderstood, why certain treatments seem to help only temporarily, and what your body may actually be trying to tell you. More importantly, you'll learn why this isn't simply an acid problem, as so many people believe. Because once you understand what's really happening inside your body, many of the recommendations you'll hear later will finally begin to make sense. If you enjoy practical medical explanations that help you understand not only what is happening but also why it happens, consider subscribing. Every week I share evidence-based information designed to help adults stay healthier, more active, and more confident as they get older. Now, before we talk about solutions, we need to clear up one of the biggest misunderstandings surrounding reflux. And that misunderstanding changes almost everything people think they know about this condition. Let's start by clearing up one of the biggest misconceptions about acid reflux. Ask almost anyone what causes reflux, and you'll probably hear the same answer. My stomach makes too much acid. It sounds reasonable, and in some situations, excess acid can certainly make symptoms feel worse. But here's something many people are surprised to learn. The amount of acid in your stomach is often not the real reason reflux happens in the first place. To understand why, we first need to appreciate that stomach acid is not your enemy. In fact, your body depends on it every single day. Stomach acid helps break down the protein in the food you eat so your digestive system can absorb important amino acids. It acts as one of your body's first lines of defense by destroying many harmful bacteria and microorganisms before they reach your intestines. It also helps release nutrients like vitamin B12, iron, calcium, and magnesium from food, making them easier for your body to absorb. Without enough stomach acid, digestion becomes less efficient. Food remains in the stomach longer, nutrients become harder to absorb, and unwanted fermentation can begin to occur. So acid itself isn't something your body accidentally produces. It's something your body needs. The real question isn't whether acid exists. The real question is why it ends up somewhere it was never meant to go. Think about carrying a travel mug filled with hot coffee. The coffee isn't dangerous while it stays safely inside the mug. That's exactly where it's supposed to be. But if the lid isn't sealed properly, every step you take increases the chance that the coffee splashes out onto your hands. Would you blame the coffee? Of course not. The problem is that the container can no longer keep it where it belongs. Your digestive system works in a surprisingly similar way. Food travels down your esophagus into your stomach through a small muscular opening called the lower esophageal sphincter, often shortened to the LES. Most of the time, this ring of muscle stays tightly closed, opening only briefly when you swallow. You can think of it as a security gate between two different environments. One side is designed to tolerate powerful digestive juices, the other is not. When that muscular gate closes properly, everything stays exactly where it should. Digestion continues normally, and you never notice it's there. But over time, several things can interfere with how well that gate performs. Age naturally changes muscle strength throughout the body, and the LES is no exception. Large meals create more pressure inside the stomach. Extra abdominal weight can push upward against the stomach. Certain foods, drinks, medications, and even everyday habits may encourage the muscle to relax when it shouldn't. Eventually, the pressure inside the stomach becomes greater than the valve's ability to keep everything contained. When that happens, stomach contents begin moving in the wrong direction. Notice I didn't say acid. I said stomach contents. That's an important distinction. What moves upward may include acid, digestive enzymes, partially digested food, and gases created during digestion. The acid certainly contributes to irritation, but it's only one part of the mixture. Understanding this changes the entire conversation. If reflux were simply caused by producing too much acid, then reducing acid alone would solve the problem every time. But many people continue experiencing throat irritation, coughing, or regurgitation even after taking acid-suppressing medications. Why? Because lowering acidity doesn't necessarily stop material from traveling upward. Imagine placing a towel under a leaking ceiling without repairing the roof. The towel may reduce the damage you see on the floor, but the leak itself is still there. That's why some treatments successfully reduce discomfort while the underlying mechanical issue continues. This doesn't mean acid-reducing medications aren't valuable. They absolutely have an important place in medicine. They help protect damaged tissue, allow inflammation to heal, and reduce complications for people who truly need them. But they aren't designed to strengthen the valve itself, and that's a difference every patient deserves to understand. Once you begin looking at reflux as a problem involving pressure, muscle function, and movement instead of simply too much acid, many everyday habits suddenly become much more meaningful. In the next section, we're going to explore a form of reflux that often escapes attention altogether. It's the reason thousands of people keep treating their throat while the real source of the irritation continues quietly below. Now that we've established reflux isn't simply about producing too much stomach acid, let's talk about the version that surprises people the most. This is the form that often slips under the radar because it doesn't always cause the symptom everyone expects. No burning chest. No severe pain after meals. Sometimes not even indigestion. Instead, it quietly affects your throat. Doctors refer to this condition as laryngopharyngeal reflux, or LPR. You may also hear it called silent reflux. The name fits because many people never realize their digestive system is responsible for what they're feeling. Imagine watering a garden with a hose. After you turn the faucet off, the water stops flowing, but the ground remains wet for quite some time afterward. Your throat can behave in a similar way. A reflux episode may last only a few moments, yet the effects can linger for hours because sensitive tissues have already been exposed to substances they were never designed to handle. One of those substances is an enzyme called pepsin. Pepsin plays an essential role inside the stomach. Its job is to help digest protein, working alongside stomach acid to break food into smaller pieces your body can absorb. Inside the stomach, that's exactly where pepsin belongs. But when reflux carries pepsin upward into the throat, the situation changes completely. The tissues lining your throat are delicate. Unlike the stomach, they have very little protection against digestive enzymes. Here's an easy way to picture it. Imagine getting fine sand trapped inside your shoes during a walk. Even after you stop walking, those tiny grains continue rubbing against your skin with every step until they're finally removed. Pepsin behaves in much the same way. Even after the reflux episode has ended, traces of the enzyme may remain on the tissues of the throat. If those tissues are repeatedly exposed to acidic foods or drinks later in the day, the enzyme can become active again, continuing to irritate the area long after you thought the reflux had passed. That's one reason some people wake up every morning with the exact same symptoms. Not because reflux is happening continuously throughout the night, but because yesterday's irritation hasn't completely settled. This also explains why throat symptoms can seem so confusing. Many people describe a constant need to clear their throat. Others say it feels like something is stuck there, even though swallowing is perfectly normal. Some notice their voice becoming raspy after sleeping. Others develop a dry cough that appears without warning, especially after meals or when lying flat. Many simply complain about thick mucus that never seems to disappear. Individually, none of these symptoms automatically point toward reflux. Together, however, they begin forming a recognizable pattern. Unfortunately, because the discomfort is felt in the throat rather than the chest, it's easy to mistake it for allergies, sinus drainage, seasonal irritation, or even repeated respiratory infections. I've spoken with patients who changed allergy medications multiple times, visited ear, nose, and throat specialists, and even worried they were developing chronic lung disease before anyone considered looking at their digestive system. That delay is understandable. The body doesn't always reveal the source of a problem in the same place where you experience the symptoms. Pain from the gallbladder can be felt in the shoulder. Heart problems sometimes cause discomfort in the jaw. Likewise, irritation in the throat doesn't always begin in the throat. Sometimes the origin is much lower. Understanding this connection changes the way you interpret what your body has been telling you. Instead of asking, "Why is my throat bothering me every morning?" a better question becomes, "What keeps reaching my throat while I'm asleep or shortly after I eat?" That small change in perspective opens the door to far more effective solutions. Because once we understand what is actually driving reflux, we can begin addressing the factors that encourage it to happen in the first place. And as you're about to see, many of those factors are part of everyday routines that most people never think twice about. By now, you know that reflux isn't simply a matter of how much acid your stomach produces. It's largely influenced by pressure and by how well the lower esophageal sphincter can keep stomach contents where they belong. That naturally leads to the next question. What creates that pressure in the first place? For many people, the answer isn't a disease. It's the small routines they repeat every single day. Let's begin with one of the most common: eating until you're completely full. Our bodies are remarkably good at telling us when we've had enough food, but modern eating habits often encourage us to ignore those signals. We continue eating because the meal tastes good, because food is still on the plate, or simply because we're distracted by television or conversation. The difference between feeling comfortably satisfied and feeling overly full may seem small in the moment, but inside your stomach, it can be significant. Think of your stomach as a flexible storage pouch. It expands naturally as food enters, but every additional bite stretches its walls a little further. As that expansion continues, pressure inside the stomach gradually rises. Eventually, that pressure begins pushing upward against the lower esophageal sphincter. If the valve is already slightly weaker due to age or other factors, it doesn't need much encouragement before allowing stomach contents to move in the wrong direction. That's why many digestive specialists encourage a simple habit that has been practiced in several cultures for generations. Instead of eating until you can't fit another bite, aim to finish your meal when you feel comfortably satisfied. Not hungry, not stuffed, simply satisfied. Many people are surprised to discover that reducing portion size doesn't just improve digestion. It often reduces reflux episodes as well, because it lowers the amount of pressure the stomach has to manage after every meal. The second habit is lying down too soon after eating. This one seems harmless. You've had dinner, you're feeling relaxed, and you decide to stretch out on the couch to watch television. Or perhaps you head straight to bed after a late evening meal because you're tired. The problem is that digestion is still working hard. Your stomach hasn't finished processing what you've eaten, and gravity is one of the tools your body quietly relies on to keep stomach contents moving in the right direction. When you're standing or sitting upright, gravity naturally helps keep food and digestive fluids inside the stomach. Once you lie flat, that advantage largely disappears. Now the lower esophageal sphincter has to do almost all the work by itself. If pressure inside the stomach is already elevated, reflux becomes much more likely. That's one reason many experts recommend allowing at least 3 hours between your final meal and bedtime whenever possible. This gives your stomach valuable time to begin emptying before you remove gravity from the equation. Another habit people rarely think about is how they sleep. Believe it or not, the side of your body you sleep on can influence reflux. The stomach isn't positioned perfectly in the center of your body. Its natural shape and location mean that sleeping on your left side generally keeps stomach contents lower than the entrance to the esophagus. Sleeping on the right side, however, may place that opening in a position where stomach contents can reach it more easily. It sounds like a small difference, but over the course of an entire night, small differences repeated for several hours can become meaningful. Some patients notice fewer nighttime symptoms simply by changing their sleeping position for a few weeks. Another simple adjustment involves raising the head of the bed slightly, rather than adding extra pillows. Many people stack pillows under their head, believing they're sleeping at an angle. Unfortunately, this often bends the neck and upper back without actually lifting the entire upper body. A gentle incline created by elevating the bed itself allows gravity to assist throughout the night while keeping the body in a more natural position. Finally, let's talk about something many people wear every day without giving it a second thought: tight waistbands, belts fastened too firmly, compression garments, even spending long periods bent forward after a large meal. Each of these increases pressure inside the abdomen, and that pressure is transmitted directly toward the stomach. On their own, these factors may seem insignificant. Combined with a large meal or a weakened valve, however, they can become the final push that allows reflux to occur. What's fascinating is that none of the habits we've discussed actually increase stomach acid. Instead, they influence the mechanical forces acting on your digestive system. And once you recognize that pattern, reflux starts making far more sense. But reducing pressure is only one piece of the puzzle. There's another approach that many people have never heard about, one that works without reducing stomach acid at all. Understanding how it works may completely change the way you think about managing reflux, and that's exactly what we'll explore next. Now that we've identified the everyday habits that increase pressure inside the stomach, let's shift our focus toward practical strategies that can help reduce reflux episodes more effectively. One of the biggest mistakes people make is assuming every solution has to involve reducing stomach acid. In reality, some of the most helpful approaches don't change acid production at all. Instead, they focus on preventing stomach contents from traveling upward in the first place. Let's begin with one option that many people have never heard about. You may be familiar with antacids. These products work by neutralizing some of the acid already present in the stomach, which can provide temporary relief for occasional discomfort. But there's another category of treatment that works in a completely different way. It's based on ingredients called alginates. Rather than changing the chemistry of your stomach, alginates create a protective physical barrier above the stomach contents after they come into contact with gastric fluid. Think of it like placing a floating protective shield over the surface of the stomach's contents. If small amounts of reflux occur, that protective layer is often what reaches the esophagus first, instead of the acidic digestive mixture underneath. In other words, the goal isn't to stop your stomach from doing its job. The goal is to reduce what can travel upward when pressure temporarily overcomes the valve. This approach makes particular sense for people whose symptoms appear mainly after meals or shortly after lying down. It's important to remember that different countries have different formulations and brand names, so it's always worth discussing the most appropriate option with your healthcare provider before starting any new treatment. Now let's move beyond medications and talk about something even more powerful: daily routines. Because even the best treatment becomes less effective if the same habits continue creating excessive pressure inside the stomach. One habit that deserves much more attention is meal timing. Many people eat lightly throughout the day, only to consume their largest meal late in the evening. From a reflux perspective, that's often the most challenging time to overload the stomach. Your digestive system naturally slows as your body prepares for sleep. If a large dinner is followed by lying down within a short period, the stomach is still actively processing food while gravity is no longer helping keep everything in place. Instead, consider making lunch your largest meal whenever your schedule allows, with a lighter evening meal several hours before bedtime. This simple adjustment won't eliminate reflux overnight, but for many people it noticeably reduces nighttime symptoms after several weeks of consistency. Eating more slowly can also make a surprisingly large difference. Your brain doesn't instantly recognize fullness. It takes time for signals from your digestive system to reach the centers in your brain that regulate appetite. When meals are rushed, it's easy to eat far beyond what your stomach actually needs before those signals have a chance to arrive. By slowing down, chewing thoroughly, and putting your utensils down occasionally between bites, you naturally give your body time to recognize satisfaction before uncomfortable fullness develops. Another strategy is taking a gentle walk after meals. Notice I said gentle. This isn't the time for vigorous exercise, heavy lifting, or activities that sharply increase abdominal pressure. A relaxed walk of 10 to 15 minutes encourages normal digestion and helps food continue moving through the digestive tract while you remain upright. Many patients find that this simple habit leaves them feeling lighter after meals, while reducing episodes of regurgitation later in the evening. Hydration also deserves a balanced approach. Drinking enough water throughout the day supports healthy digestion, but consuming very large amounts of liquid during a heavy meal can temporarily increase the volume inside the stomach. Rather than drinking several large glasses all at once during meals, many people feel more comfortable by staying well hydrated between meals and taking smaller sips while eating. None of these adjustments are dramatic. That's exactly why they're often overlooked. People naturally search for a single powerful solution, when in reality reflux usually improves through several small changes working together. Each habit reduces a little pressure. Each adjustment gives the lower esophageal sphincter a little less work to do, and over time, those small improvements begin adding up. However, there is another piece of the puzzle that many people unknowingly make worse every day. Certain foods, drinks, and lifestyle habits don't just increase pressure, they can actually encourage the valve itself to relax. Understanding which ones affect you personally may be one of the most valuable discoveries you make, and that's exactly where we're going next. At this point, we've talked about pressure, meal size, body position, and daily routines. Those factors alone can make a remarkable difference for many people. But there's another piece of the picture that's just as important. Some foods and lifestyle habits don't necessarily create more stomach acid. Instead, they may influence how well the lower esophageal sphincter performs its job. And that's an important distinction, because if the valve becomes more relaxed than it should be, stomach contents have a much easier path upward. Let's start with something that surprises many people: mint. Whether it's peppermint tea after dinner, mint candies, or breath mints, many people associate mint with soothing digestion. While it may help some digestive complaints, peppermint has also been shown to relax smooth muscle, including the lower esophageal sphincter in some individuals. That doesn't mean everyone needs to avoid mint forever. But if you've developed persistent reflux symptoms and regularly consume peppermint products, it's worth performing a simple experiment. Remove them for 2 or 3 weeks and observe whether your symptoms begin to improve. Chocolate is another common trigger. Most people assume chocolate causes reflux because it's sweet. The reality is more complicated. Chocolate naturally contains compounds such as theobromine, which may encourage the lower esophageal sphincter to relax. In addition, chocolate is often high in fat, and fatty foods generally remain in the stomach longer before emptying. That combination means the stomach stays fuller for a longer period, while the valve may also be slightly less effective at staying tightly closed. For someone already experiencing frequent reflux, those two effects can reinforce one another. Alcohol deserves careful attention as well. Besides irritating the lining of the esophagus, alcohol can temporarily reduce the strength of the lower esophageal sphincter. Many people also enjoy alcoholic beverages in the evening, often within a few hours of bedtime. Unfortunately, that's exactly when reflux is most likely to become noticeable. The timing matters just as much as the amount. If reflux tends to disturb your sleep, avoiding alcohol close to bedtime may provide greater benefit than simply reducing the quantity. Smoking presents another challenge. Nicotine doesn't just affect the lungs or blood vessels. It also influences muscle function throughout the body, including the muscle responsible for separating the stomach from the esophagus. Research has consistently shown that smoking can weaken the resting tone of the lower esophageal sphincter, making reflux episodes more likely over time. For many people, improving reflux becomes one more meaningful reason to consider quitting. Now let's talk about foods that often generate unnecessary fear. Coffee, tomatoes, citrus fruits, spicy meals. If you've searched online, you've probably seen long lists telling everyone with reflux to eliminate these foods permanently. In my experience, that approach is often too simplistic. Not every person reacts the same way. I've seen patients who drink 1 cup of coffee every morning without experiencing any noticeable symptoms. I've also seen others whose throat becomes irritated within an hour. The same individual variation exists with tomatoes, oranges, spicy dishes, and many other foods. Rather than assuming every item on a list is harmful forever, I encourage a more thoughtful strategy. If your symptoms are active, temporarily remove one suspected trigger for 2 or 3 weeks. Allow your throat and esophagus time to settle, then reintroduce that food by itself while keeping the rest of your routine unchanged. This approach gives your body the opportunity to provide useful feedback. When several dietary changes happen at once, it's almost impossible to know which food is truly responsible. But when foods are tested individually, patterns become much easier to recognize. Your goal isn't to build a shorter list of foods you can never enjoy again. Your goal is to understand how your own body responds. Before we finish, there's one popular remedy that deserves a balanced discussion: apple cider vinegar. Some people believe reflux develops because the stomach isn't producing enough acid, especially later in life. According to this theory, adding a small amount of vinegar may improve digestion, reduce fermentation, and ultimately decrease pressure inside the stomach. There is some physiological reasoning behind this idea in carefully selected situations. However, there's an important limitation. If your esophagus or throat is already irritated, swallowing an acidic liquid may increase discomfort rather than reduce it. Think about what happens when lemon juice touches a small cut on your finger. The juice isn't dangerous by itself, but damaged tissue is much more sensitive than healthy tissue. The same principle applies here. If you already have burning pain while swallowing, or confirmed inflammation of the esophagus, apple cider vinegar is unlikely to be the safest place to begin. That's why I encourage patients to avoid following internet trends without considering their individual circumstances. The right approach depends on what's actually causing the symptoms, not on what happens to be popular online. So far, we've focused on reflux itself, but here's something equally important. Not every persistent cough, not every hoarse voice, and not every sensation of mucus in the throat is caused by reflux. Knowing when to look beyond reflux may be just as important as understanding reflux itself, and that's exactly what we'll discuss in the final part of this video. By now, we've covered what reflux really is, why it often develops, and the daily habits that can either improve or worsen it. But before we finish, there's one final message I believe every viewer should hear. Not every throat symptom is caused by reflux, and not every case of reflux should be managed at home. Understanding the difference is one of the most important steps you can take to protect your long-term health. Let's begin with the first point. A persistent cough doesn't automatically mean stomach contents are reaching your throat. Seasonal allergies can produce very similar symptoms. So can chronic sinus drainage. Asthma sometimes presents primarily as a cough, rather than wheezing. Even certain medications deserve consideration. One group of blood pressure medications, known as ACE inhibitors, has long been associated with a dry, persistent cough in some patients. If your cough began after starting one of these medications, it's worth discussing that possibility with the healthcare professional who prescribed it. The important lesson is this: don't assume every symptom has a single explanation. Instead, pay attention to patterns. If your symptoms consistently appear after meals, if they become worse when lying down, if they improve after changing your eating habits or sleeping position, those clues make reflux more likely. But if nothing changes despite making these adjustments for several weeks, it's time to look deeper rather than continuing to guess. Now let's discuss situations where you shouldn't delay seeking medical care. Difficulty swallowing that gradually becomes worse is never something to ignore. Occasionally, swallowing awkwardly happens to everyone. Progressively feeling as though food is sticking on its way down is different. That deserves proper evaluation. The same is true if swallowing becomes painful or uncomfortable. Another warning sign is unexplained weight loss. If you're eating normally but losing weight without trying, your body may be telling you that something more significant is happening. Blood is another symptom that should always be taken seriously. Vomiting blood, material that resembles dark coffee grounds, or black tar-like stools can indicate bleeding somewhere in the digestive tract and require prompt medical attention. Persistent chest pain should also never be dismissed as just reflux. Reflux can certainly cause chest discomfort, but heart disease can present in a similar way. If you're uncertain which one you're experiencing, always seek immediate medical assessment rather than assuming it's your stomach. It's far better to rule out a heart problem than to overlook one. Persistent anemia without a clear explanation, ongoing vomiting, repeated choking episodes while eating, or symptoms that continue worsening despite treatment also deserve further investigation. Sometimes additional testing, including an upper endoscopy, is necessary to understand exactly what's happening inside the esophagus and stomach. These situations require personalized medical care, not home remedies. One thing I've learned after many years of caring for older adults is that the people who achieve the best long-term outcomes aren't necessarily those who never develop health problems. They're the ones who learn to recognize meaningful changes early. They notice new symptoms, they ask questions, they understand how their bodies work, and they seek help before small problems become much larger ones. That's exactly why I wanted to make this video, because understanding reflux changes the conversation completely. Instead of seeing it as nothing more than too much stomach acid, you begin recognizing it as a condition influenced by several factors working together. It's affected by pressure inside the stomach, by the strength of the lower esophageal sphincter, by your posture after meals, by your sleeping position, by the foods and drinks that are unique to your body, and by the daily habits you repeat without even thinking about them. When you understand those pieces, you're no longer relying on guesswork. You begin making decisions based on how your digestive system actually functions. Remember, the goal isn't to eliminate every food you enjoy or become anxious about every sensation in your throat. The goal is to recognize patterns, reduce unnecessary stress on your digestive system, and work with your healthcare provider to develop an approach that fits your individual needs. Small, consistent changes are almost always more powerful than dramatic short-term fixes. One better meal, one healthier evening routine, one more hour between dinner and bedtime, one habit improved at a time. Those choices may seem insignificant today, but over months and years they can make a meaningful difference in both your comfort and your overall digestive health. If you found today's explanation helpful, I encourage you to continue learning about how different parts of the digestive system work together. Many people are surprised to discover that problems affecting the stomach, intestines, and colon often share common lifestyle patterns. In the next video, I'll explain how chronic inflammation can quietly develop in the digestive tract long before obvious symptoms appear, and the simple everyday habits that may help support a healthier gut as you get older. Thank you for spending this time with me today. Take good care of yourself, stay curious about your health, and I'll see you in the next video.